Every third Thursday from 10:30 to 11 a.m. on Radio Trinidad 730 a.m. A very good morning to you, Trinidad and Tobago, and to our international community. Yes, we are global here at Radio Trinidad Inspirational Radio 730 a.m. I'm Karen Rudd, your host, the host of the Wellness and You show, and I'll be keeping you company, spending some time with you for the next 30 minutes. So we only have 30 minutes. It's approximately 10:30 to be exact, 10:30 and 19 seconds, going up until the hour of 11. And today's discussion will be about piriformis syndrome, sciatica, and neck pain. I am a U.S. trained deep tissue massage therapist, reflexologist, infant touch and massage instructor, Cranio Sacral Therapist, Reiki master, EFT or emotional freedom technique practitioner, Equine or horse sports massage therapist, and professional makeup artist. And I'd like to also share with you that I am not a medical doctor and cannot give you medical advice. However, within the scope of my practice, I can share information with you and make suggestions as it relates to my therapeutic bodywork background. If I feel that your situation is in need of medical intervention, then I will make necessary suggestions. Please feel free to call in with a question to the show now at this time at 623-7301. That's area code 868 for those of you outside of Trinidad and Tobago, because we are global here at Radio Trinidad Inspirational Radio 730 a.m. Again, the number is area code 868-623-7301. And if you're on the internet, please feel free to tune in to www.inspirationalradio730.com. I'll repeat that again. www.inspirationalradio730.com. It is the show is in HD, which means that you can see me and hear me simultaneously. So I am live here in the radio station studio, and for those of you who have access to the internet, either on your smartphone or your laptop, iPad, you can tune in, as I mentioned, and you can see me live and hear me live as well. How does that sound? Okay, I'd also like to invite you to visit my website. It is www.karenrudd, and that's KARYNRUDD.com, www.karenrudd.com for more information. And if you'd like to send an email, you can please feel free to do so by writing karenrudd@gmail.com. Again, KARYNRUDD@gmail.com. Or if you wish to book an appointment, you can feel free to call area code 868-301-4500. That is 868-301-4500. You can also find me on Facebook under the name Karen Rudd. Again, it's KARYNRUDD, Wellness and You. Karen Rudd, Wellness and You, and have a look there as well and see some of what I do. So as I mentioned, you can feel free to call into the show anytime between now and 11 o'clock at area code 868, as I mentioned, 868-623-7301, and make a contribution in terms of the subject matter we're discussing today, or if you have a question outside of the realm of the subject matter that we're discussing, you can feel free to do so as well. So today, as I mentioned, we're starting with the subject matter of the piriformis syndrome, sciatica, and neck pain. And piriformis syndrome, I'm really surprised that a number of persons do not know what piriformis syndrome is. So let me do my best to enlighten you today in as simple language as possible so that everyone gets to understand. Now, in the hip area, there are muscles that allow us to rotate our thigh bone, our thighs, our legs. And these are called hip rotators. One muscle in particular is the leading, if you will, muscle called the piriformis muscle. Now, the sciatic nerve, which is the largest and longest nerve in the human body, goes across the hips and down each leg. This nerve goes in between the hip rotators, in between the piriformis muscle and the other hip rotator muscles. And unfortunately, when we sit for very long periods of time, or in some cases, some of us cross our legs, in other cases, some men wear their wallets in their back pockets, regardless of how one may sit, whether it's at work, whether it's driving, or whatever the case is for you especially, sitting on one hip more so than the other, unfortunately, can compress the nerve. When the nerve becomes compressed, it becomes inflamed. I know I touched on this subject matter a little bit in the last show that aired on February 21st. So today it being Thursday, March 21st, which is a special day for me. It's also my birthday. So it's a double celebration to be here with you, to keep you company, give you some information, and just to celebrate the time to be here, period, to still be on the planet. So to just enlighten you a little bit about what piriformis syndrome is, as I mentioned, it is a neuromuscular disorder. So neuro means the nerve, and muscle is the muscle itself. And it occurs when the sciatic nerve is compressed, as I mentioned, otherwise irritated by the piriformis muscle. Again, it's irritated by the piriformis muscle that will cause pain and tingling and numbness in the buttocks and along the path of the sciatic nerve, descending down the lower thigh and into the leg. Now, diagnosis is often difficult due to few validated and standardized diagnostic tests. But two have been well described and clinically validated. One is electrophysiological, called FAIR, or FAIR test, which measures delay in the sciatic nerve conductions when the piriformis muscle is stretched against it. And the other is magnetic resonance neurography, and it's a sophisticated version of MRI that highlights inflammation and the nerves themselves. So some say that the most important criterion is the exclusion of sciatica resulting from compression or irritation of the spinal nerve roots, as by herniated discs, for example. However, compression may be present but not causal in the setting of sciatica during or due to piriformis syndrome. So piriformis syndrome, as I mentioned, is basically the piriformis muscle that shortens and tightens. When it shortens and tightens, it compresses the nerve. When it compresses the nerve becomes inflamed, and when it becomes inflamed, again, because it is the longest and largest nerve in the human body, it goes across the hips, as I mentioned, and down each leg, then it can, in very severe cases or acute cases, when the nerve becomes inflamed, numbness will ensue. And of course, if numbness ensues, what happens thereafter? One cannot walk, because if you cannot feel your leg, you really cannot feel the ability to connect with the earth and move through time and space. So piriformis syndrome, again, for those of you who are able to view this radio show right now, and I'm just doing a demonstration with my fingers, if one puts one's hand up in front of your face and separate the fingers, the nerve actually goes in between the piriformis muscle and the gellimus superior muscle. Those are some of the names of the hip rotators that allow us to rotate our hips. So when the piriformis muscle becomes shortened and tightened through the lack of stretching or sitting for long periods of time, it compresses the nerve. So when it compresses the nerve, again, the nerve becomes inflamed. And when that happens, the condition is called sciatica, or inflammation of the sciatic nerve. So that is what piriformis syndrome is. How does intervention assist or relieve someone with this condition, for example? So as a deep tissue massage therapist, when a person is lying face down on the table, with the hands-on manual manipulation, we can manipulate the piriformis muscle enough that it takes away the swelling in the muscle. It lengthens the muscle, thus taking off the compression from the nerve. In the case where the nerve becomes compressed, then of course the gliding up and down the legs and the manipulation of the muscles along the leg will also affect the amount of inflammation in the nerve, thus reducing the amount of pain. So those are things to think about. So I started particularly with piriformis syndrome because I really was stunned last month when I got to find out about a case where someone of great importance in the medical profession did not know what piriformis syndrome was. I was really taken aback, really surprised that a medical doctor, of course I will not name names, had never heard of the syndrome called piriformis syndrome. And so that really befuddled me, and I just felt really inspired to share some of what it's all about. So uncontrolled studies have suggested theories about the disorder. However, however, a large-scale formal prospective outcome trial found that the weight of the evidence-based medicine is that piriformis syndrome should be considered as a possible diagnosis when sciatica occurs without a clear spinal cause. And so it's a syndrome because they're not really sure what would bring on the swelling of the nerve, or rather the swelling of the muscle, and the shortness and tightening of the muscle. But again, if one sits for long periods of time without mobilizing the body, or if one sits on one hip more than the other, so check yourself when you sit at your desk. Make sure you're sitting equally on both hips. When you sit to drive, make sure you're sitting equally on both hips. That's something to think about. Now, if you have a question, if you'd like to call in with a question, or if you'd like to make a contribution as regards the subject matter, even if it's not regarding the subject matter, or just have an issue about another condition that may be occurring in your body, please feel free to call. You can call in at area code 868-623-7301 to make a contribution to the subject matter. Otherwise, if you'd like to book an appointment, you can feel free to call area code 868-301-4500. Please remember, please, I'm asking, remember to leave a voicemail message. The call volume is very high, so it's virtually impossible to see a number of calls that come through and call back every single number. So if it is important, I strongly suggest you leave a message, because if you don't leave a message, I can't call you back. All right, just to share that with you. All right, so if you are a sufferer of sciatica, or if you know someone who is, if you're not sure if the person may have Piriformis syndrome that may bring on sciatica, then it would be a suggestion to consider having intervention of some kind, so that the person can get out of pain. Now, if you are a person with neck issues, for example, a lot of persons suffer with neck problems at this point in time because, a lot of us sit at our desks for long periods of time, and the computer screen may not necessarily be at eye level. It's very important that it be at eye level so that it does not interfere with the alignment of the neck. So that is very important, and that's called being ergonomically correct. In the times that we live in today, everybody's texting and typing, everybody's on their cell phones and looking down a lot. And again, that can cause issues with the neck. And so one of the things that can happen as a result of that is that the muscles at the front of the neck can shorten and tighten, and then the muscles at the back of the neck can hyperextend or lengthen to the point where it affects the alignment of the bones of the neck. So unfortunately, the reason that the skeletal system, or the spinal column rather, has the curves, the natural curves that we're born with, is for shock absorbency. So when we walk and we move through time and space, it absorbs shock when we walk. Very, very important. So what happens then, it's important every half an hour to put the head back, to lean backwards, so that the muscles at the front of the neck begin to lengthen. So when the muscles shorten and tighten, those are some of the things that can happen. As a result of neck pain, some people can develop migraines or many forms of headaches, and migraines can be very uncomfortable. And of course, that can also bring on the issue with the shoulders. So a lot of us may be sitting at our desks and not realizing that as we're sitting there, we're raising the shoulders. And of course, those shorten and tighten the shoulder muscles that also affect the neck muscles, that would affect the general well-being of the structure of the body. Now, the weight of the average adult head is 10 pounds. So the neck muscles work very, very hard as it is to begin with. And so when we add more pressure to them by, as mentioned, looking down for long periods of time, that could inevitably affect the muscles' ability to function and do their jobs well. So let's start practicing being ergonomically correct. If you're going to be at your desk, please see if you could change the screen of your computer screen to eye level. If you are at a laptop, then the suggestion would be to get a wireless keyboard so that you can place the laptop screen at eye level and look directly at it as opposed to looking down. If you have to look down for long periods of time, as mentioned, every half an hour, put the head back, and that way you lengthen the muscles. And even do the side bends, the side bend exercises of the neck, the head back and the head forward, and rolling the head clockwise and anti-clockwise. So once again, if you have any questions, please feel free to call in. This is Inspirational Radio 730 AM. I'm Karen Rudd, your host, right up until 11 o'clock. So I've got just about 15 minutes left with you to give you some information. So if you have any questions regarding what we're talking about today or anything else, please feel free to call us at area code 868-623-7301. And again, if you are at a computer, if you have internet access, you can go to www.inspirationalradio730.com. This is in HD, so we have the audio and the video available for your viewing pleasure. So please feel free to call in and ask any questions if you wish at this time. Otherwise, if you choose to make an appointment, you can do so as well. Okay, we've got a live call. Caller, you're on the air.
Good morning.
Good morning.
I would like to know what is thrombosis.
Thrombosis. And where do you have thrombosis?
In the calf, the left calf.
The left calf. How long have you been a sufferer of it?
Well, I don't know that I have it. I just find that left calf is swollen.
Okay. And how long has that been happening?
A long while now.
Has it been more than a year?
No, not so long.
Okay. Is it more recent, like a month or a few months, a few weeks, a few days?
More months than days.
More months and days. Have you been to your doctor about this?
No. Well, yes, I went to the doctor and showed him, and I had a X-ray, and I think I saw the word thrombosis. So that's why I'm asking you, what is thrombosis?
Okay. So the pain that you is it just one calf or is it both calves?
One calf, the left calf.
Okay. Did the doctor say that this will pass over time, or what was his suggestion?
No, he didn't say anything.
He didn't say anything at all?
That's why I'm asking you now, what is thrombosis?
Okay, now osis means degeneration. Itis means inflammation.
Okay.
So there's degeneration taking place in the calf area. Do you have access to a computer?
No.
You do not? Okay. Well, what I can suggest you do then is give me a call off the air at 301-4500. Leave a voicemail message, leave your phone number, your contact information. I will call you back and we can speak further at length, because there's some other callers that are trying to get in.
Yeah, but could you tell me what is thrombosis?
Okay, I would rather answer your question off the air. So if you could call back at 301-4500
you
after 11.
You could help other people listening to know what is thrombosis?
Absolutely, I can. But as I mentioned, I need to speak with you further regarding your situation. Osis means degeneration. Itis means inflammation.
Okay,
so there's
thank
degeneration
you very
that's taking place in the calf.
Thank
You're welcome.
you very much.
You're welcome. Okay, so if you have a question, please feel free to call in at area code 868-623-7301. And we've got another caller. Caller, good morning.
Good morning.
Good morning.
My question to you is, I am with pain in the calf, but no swelling. Of course, is that related to the migraine headache also?
You said you're having pain in your calves?
Yeah, the right and left leg. Would
Okay.
that give you a migraine headache also?
Well, I do not know. How long have you had the pain in the calves?
It's on and off, especially when I'm stressed out.
When you're stressed out?
Yeah.
And whenever you have the pain in the calves, do you get the headaches as well at the same
No,
time?
not at the same time.
Not at the same time.
Sometimes I get headaches, so I want to know if that is part of the cause.
Okay. How long have you been getting the pain in the calves?
Oh, a very long time, years now.
Years.
But only under stress.
Only under stress. And how long have you been suffering with headaches? Are they migraine headaches or other than migraine?
No, it comes on maybe every month or so.
Every month. Do you know if they're migraine headaches or other than migraine? A migraine headache is just one side of the head.
Yeah, the left side.
The left side. Okay. And so the onset of the issue with the calves, have you been having the migraine headaches the headaches longer than the calf issues?
No. The calf issue is under stress, the headache, once in maybe every 2-3 months.
Once in 2 or 3 months. And you've had the headaches longer than you have the issues with the calves?
Not really.
Okay. They more than likely are not related. This is why I'm asking you a barrage of questions, just to fine-tune exactly how long you've had the issues and when you would notice that the headaches would occur. more than likely, if the issues of the headaches were occurring at the same time that the calves issues, or issue rather, is occurring or occurs, then I could say that they may, as well as they may not be related. But the thing is, everything in the human body is related. That's the other thing, because the nerves all connect.
Okay.
So if you're having it at the same time, I would say more than likely, well, obviously they must be connected because you're having it at the same time, but you're not. Now,
Yes.
the issue with the calves, is it sharp shooting? Does it feel like a spasm? What does it feel like to you?
Not really, just kind of a mild.
Mild, okay. Does it occur when you're sleeping?
No,
When would you notice that it occurs?
it only occur actually if I take on something stressful.
Okay. And the only area that the body would manifest the stress is in the calves, area of the calves. Do you have difficulty walking?
No,
Okay. So when would you feel the pain then? Is it just when you're mobilizing or when you're just sitting still?
excuse me.
When do you feel the pain in the calves? When you're moving or when you're just staying still?
Moving.
When you're moving. Okay. Have you seen anyone about this issue?
No.
All right. Or would you like to make an appointment after the show airs? You can, if you
Okay.
wish, call at
All right.
301-4500 and manual intervention can be done. Also, you may want to consider, I don't know what your potassium intake is at this time. You may want to look at your supplementation as well in terms of diet. So these are some things that we need to talk about further. So if you'd like to call off the air 301-4500 to make an appointment, you can do so, or we can just speak further.
Okay, the lady that you were speaking to a while ago,
Mm-hmm.
I have an idea why you would not like to refer the question she asked on the air.
Okay.
Was the word thrombosis.
Mm-hmm.
So I know what it is. Okay.
Yes. Okay.
All right, have a nice day.
Thank you. Thanks for your call. All right. So we've got just a few minutes left again of the time here spending with you. So as I mentioned, we shared this morning about piriformis syndrome, sciatica, as well as neck pain. And we've got another caller. Caller, you're on the air. How can I help you this morning?
Hi, good morning, Karen. This is Wayne. I'm just
Good.
calling to wish you happy birthday.
Oh, thank you,
And
Wayne.
to commend you on the show that you're doing.
Thank you.
And also to let you know that based on when you spoke about the first thing you spoke about on the neck, it shows me the need really to exercise and do some stretching and bending, you know.
Yes.
Listening to you, I really see the need to exercise.
Do you have neck pain at this time, Wayne?
No, I used to get a lot of neck pain, and actually when I went to my doctor, I spoke to him about it, and he did give me some neck exercises to do.
Okay.
And I don't get that anymore right now.
Okay. So how long have you been relieved of that?
About just about a year and a half now.
Okay, great. So was it a
Yeah.
was it a medication only that gave you relief, or did you
No,
have
he didn't give me medication. He gave me some exercise
Or
to
stretches.
do. He told me that I can't remember what he called it, but he said something in the neck was I don't know if to say it was rubbing or something like that.
Mm-hmm.
And he gave me a sheet with some neck exercises to do.
Okay.
So even when you spoke about the computer and one having their head bent all the time, you know, a person who does that really needs to do some neck exercise
Yeah.
to balance off things.
Gosh, wait a minute. I thank you for your call. I thank you for calling in and participating and sharing that information with us so that
Right.
people can realize that really and truly it is how we posture the body, how we situate the body, how we sit, how we stand, and the repetitive actions that we perform on a regular basis that can either work for us or against us. And as mentioned before, looking down constantly shortens and tightens the neck muscles at the front of the neck. Those are called those are nice big muscles called the SCM or sternocleidomastoid muscles, and those muscles can often shorten and straighten the bones of the neck region or the cervical region. And when that happens, unfortunately, it can compress the nerves. In some cases, for some people, it can constrict blood vessels as well. So once again, I thank you for calling in and sharing that. So folks out there can realize that there is value in stretching, because ultimately the muscles, tendons, and ligaments of the body connect bone to bone. So if we keep them strong and we keep them long, then what happens is we tend to keep the bony framework of the body in alignment with itself. So I thank you so much for calling in and participating there.
I just pray that God will continue to bless you and your show, and as you continue to do it, that you will be a blessing to others.
Thank you, Wayne.
And enjoy the rest of your day.
Thank you, Wayne. Highly appreciated. Thanks for the gesture. Have a great day. All right, so it's nice to get that birthday greeting as well, incorporating the issues with the neck. And we've got another caller. Good morning, caller. You're on the air.
I'm sorry.
All righty, lost that call. That's all right. So again, if you'd wish to call in and participate in the show, you're welcome to call area code 868-623-7301. That's 868-623-7301. Otherwise, we've got another caller. Caller, good morning. You're on the air.
Good morning.
Good morning.
I hear your program. I want to know much about. I just see this dingling.
I'd like to ask you to step away from your radio, please, because there's feedback, and unfortunately I can't hear you because there's an echo.
Okay, lady. Yes. I just see this dingling in my shoulder. I'm a diabetic, and I have this pain on my left side, but it's not my pressure because my pressure is good.
Okay. And you said it's the left shoulder. What part of the shoulder?
Like only the blade of the shoulder.
The shoulder blade itself.
The neck.
Mm-hmm. The pain that you're getting, is it sharp shooting or is it a dull ache?
No, just like, like a thing, like something moving, walking in the shoulder.
Okay, so you're feeling movement. And how long have you had this issue?
A few months.
A few months, all right. Do you notice that it happens every day, at certain times of the day? When do you notice that it happens?
Like, let me say, like I lie down and I get up.
Mm-hmm.
Or I sit down for a couple of hours or whatever, I will see this dingling.
Okay. And does it eventually pass as you move? Once you get up and you start moving, does it go away?
Yes, well, it's like right now,
Mm-hmm.
it's lying down and I get up, and I get up for feeling like this little dingling in the shoulder.
Okay. Well, based on what you're saying, again, without seeing you in person and without palpating the area where you're having that particular issue, but it sounds like there could be an issue with a nerve compression, is what it sounds like it could be, that is also affecting the muscle. And why I asked you specifically, once you get up and you move around, if it goes away, is because oftentimes when we have muscular issues, not all the time, but in a number of cases, and we start to mobilize or we start to move, the sensation may go away. So it sounds as if maybe the way that you're sitting, sleeping, standing, or it could just be degeneration that may be impairing a nerve, or it could be an alignment issue that could be impairing the nerve that's affecting the muscle that's causing the pain. So again, if you wish to call me off there, you may do so to get some for more information. If you'd like to book an appointment, you're welcome to call area code 868-301-4500. Please leave a message. Please leave your phone number, because if you don't leave a message or your phone number, I can't call you back. So if you'd like to call me back off the air, then we can speak further. And if you wish to make an appointment, we can talk about that as well. And I appreciate your call. Thank you for calling in. You're welcome. All right, so that's an issue with the shoulder. We've got just under 2 minutes left, almost a minute and a half left of the show. If I can take one more call, if anybody chooses to call in at area code 868-623-7301. Otherwise, you can call me at area code 868-301-4500 off the air after 11 o'clock to book an appointment for bodywork. As I mentioned, I mostly do therapeutic bodywork, and that is for strains, sprains, bulging discs, slip discs, back issues, a number of neuromuscular issues, muscular issues, and neuro meaning the nerves, so as the nerves affect the muscles as well. Again, if I wasn't able to articulate very clearly the answer to your question on the air, then of course we can do that at another time. Once again, I thank you very, very much for tuning into the Wellness in Your show. Again, the show happens next month, same time, same station on Radio Trinidad, and that would be on the third Thursday of the month. So it's the third Thursday of each month, every month. that the Wellness on You show is. Thank you very much again. This is Karen Rutsine. Thank you for tuning in to Radio Trinidad. Have a great day.
This is Inspirational Radio 730 AM, powered by the TBC Radio Network, the nation's biggest and best network. At this time, we join our news center at CNC3 for the 11 o'clock headline news.
This is Headline News on CNC3 and the TBC Radio Network. Top of the news at this time, a woman is burnt to death in her vehicle in Carlsonfield this morning. Police officers are at the scene at this time investigating the circumstances surrounding the incident. But reports say police responded to a call shortly before 6 this morning, and when they arrived at Carlsonfield, they saw a white Isuzu pickup in flames. Officers found the charred remains of a person in the back seat of the vehicle burnt beyond recognition. A trace of the vehicle revealed the vehicle belongs to 44-year-old Jennifer Ali of Sudas Road in Freeport. Her relatives were contacted and said she left for work this morning at the Tabakit Regional Corporation. Forensic tests will be done to determine conclusively if the body is that of Ms.